My name is Adnan. 大家好，我是 Adnan. Today I'll be talking about common problems a lot of yoga students and yoga practitioners have, just tightness of hip flexor muscle. Hip flexor muscle are extremely important. They connect lower and upper part of the body, and they have deep connection with different internal organs, including the diaphragm, sacroiliac joints, ascending and descending column, and so on. So hip flexors are actually two muscles, psoas and iliacus, that blend together and attaches to the thigh bone. Psoas originates from the lumbar vertebra and transverse processes, iliacus from inside of the hip bone, the ilium, and crossing the pubic bone to attach to the lesser trochanter, the part of the thigh bone. Action of the hip flexors, as the name says, flexing the hip, abducting the hip, moving the thigh to the side, and rotating the hip externally. So I will show you the way how to assess psoas, how to do assisted stretching, helping your students or your friend, and how to do self-stretches, as well as some yoga poses that will help you treat dysfunctional psoas, and then something called positional release technique, where you'll be able to treat yourself with this particular method and help actually release tension from your hip flexor muscles. So my friend Mike will come on the table and we'll assess the psoas and treat it. So Mike will sit at the end of the table, and then I will help Mike to lie down. So I will raise the one knee, so bending the hip enough to make sure that lower back is firmly on the table. And as I bend this knee, so tight hip flexor, sign of tight hip flexor is knee is raising up, so hip is flexed, so knee is not able, thigh is not able to stay on the table and descend down. So this is sign of, in this case, tightness of the left hip flexors. So in order to treat this, to do assisted stretching, I will place the leg on my body. I will place my hand on the hip bone or anterior superior iliac spine, and then I will use my right hand to gently push the thigh down till I feel resistance, and I will stay there. So if I would use the muscular strength of muscle, hip flexor muscle, in order to release it, so what I'm going to do, I will ask Mike to push into my hand up for 8 seconds approximately, and after that, I say, inhale, Mike, and exhaling, and I will push the thigh a bit further into the stretch. Now, this is concerning assisting stretching. Now, in order to help yourself and treat and stretch your hip flexors, you will do basically the same thing. Mike will hold his leg, he will extend the thigh enough, he will contract his quadricep muscle, and then hip flexor, imagining that he's pushing the leg up towards the ceiling, and after some time, he will let go and allow stretch to happen. He can stay in this position for some time, allowing the gravity to release and lengthen the tight hip flexor muscle. To get out of this position, if you are close by, you would help your friend or your student to get up, or if you do it on your own, you use your abdominal muscle, use the leverage of your knee and leg, and you help yourself to sit into position, holding the knee.